I'm Emerson Seekins. I work in public policy. I'm a former University of Washington graduate student and employee. I was previously covered under the state employee health plan. I was denied transition-related care, routinely paying for the majority of my care out of pocket.
Hi, I'm Bobby Daly. I'm a physician at the University of Washington. There have been several of the major medical bodies that have put out policy statements saying that the arbitrary transgender healthcare exclusions should be removed from both public and private policies. These include the AMA, the American Psychological Association, WPATH, and others.
It's not just about surgery, it's also about coverage for hormone therapy, psychotherapy, which would not be covered if you put the gender identity disorder CPT code, as well as routine health care, including the historically gendered procedures such as a pap smear, prostate examination, and also mammograms. So basically, a mammogram that may be denied because it's not typically associated with that gender.
Gender Justice League has been a leader in the Coalition for Inclusive Healthcare coverage for the last 2 years, working to secure coverage for state employees so that they can access coverage for the plans that they're paying into.
I was excited to join Gender Justice League because it's an advocacy organization for trans people by trans people predominantly, and to know that we can make a difference and have a voice in the community and get these issues out in front.
You currently provide to non-transgender women estrogen therapy, for instance, or non-transgender men testosterone. That's not something that would be new. Psychotherapy is provided for anybody who needs psychotherapy in your plans. That would not be something that's new. These exclusions are specific to the healthcare that is provided if you are identified as a transgender person. And that is a key distinction for us from a legal perspective, which is that the 2006 non-discrimination law, which I've highlighted here, really clearly delineates out that exclusions that specifically target a protected category of people are not permissible under Washington state law. And I can't re-emphasize enough how important that is, that these exclusions exist to target a group for exclusion from benefits that are currently offered to non-transgender people.
I know for my family and my parents, they've been very concerned about my access to health coverage. I remember sitting down with my parents and kind of going through and explaining what these exclusions mean for my life and my care, and having them be really worried for me. What happens if I get into an emergency situation? What happens going into just the doctor's office on a routine basis? And securing this coverage has been a huge relief for myself and my family. Nobody should be denied routine care like therapy, hormones, blood work, medical visits because of who they are.
As a physician for 30 years now, transgender people not having access to routine medical care just based on who they are is against everything I believe in.
People often ask me how many hours I've put into this work. I can say that in the last 2 years, I've easily put in between 750 and 850 unpaid hours. And for Gender Justice League, that number stretches into the thousands. And our membership are people who are underemployed and marginalized. What we know from talking to transgender people and from the research is that removing these healthcare exclusions is vital. We need your help to make that happen. So the things that you can do to help: share your story with us about how these health insurance exclusions have harmed you. Tell your friends and families about these health insurance exclusions and how they're harming transgender people. Share this video with people you know. And most importantly, donate to Gender Justice League today so that we can continue to do this important work in removing health insurance exclusions wherever they exist in Washington state and ensure that transgender people are able to access health care.